Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Paediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Paediatricians with Dr. Gbemi because it's informative, educative, and interactive. Ask the Paediatricians Hour, the program for caring parents.
Hello, everyone, and welcome to this fresh episode of Ask the Pediatrician Hour. I am Gbemisola Boyede. I'm a pediatrician, and today I'll be talking to you about malaria. Obviously, malaria is one of the most common disease known to most of us in Nigeria and especially Africa. However, there have been some recent updates about malaria, and I deem it fit that we should talk again about malaria. On the 25th of April, which was just a couple of days ago, is the World Malaria Day. And this is a day set aside by the World Health Organization to create awareness and to review how far we have come in the fight in getting rid of malaria, which is one of the worst killers of our children. And so we celebrated the World Malaria Day a couple of days ago, and we're saying that it is time to deliver zero malaria. We want malaria completely eliminated, completely kicked out. And this, of course, is going to involve a lot of investment, a lot of innovation, and a lot of implementation of the strategies and all the things we already know that can help us in getting rid of malaria. So today, we're going to be talking about malaria. In as much I know that it's not something new to most of us, but there are new updates that I think we should all know about, especially when it comes to the children. All right, so thank you so much for joining me today. I want to say thank you from whichever platform you're watching from, whether you're watching on Ask the Pediatrician Facebook page or group. Thank you so much for joining us today. And for those of you who are listening on Fresh Waves Radio or listening on Ask Dr. Gbemi ATP podcast, thank you so much. We're so glad. And for those who are watching on our YouTube channel, thank you also for joining us today. And Ask the Pediatrician Hour is a program brought to you by Ask the Paediatricians Foundation. We are committed to reducing preventable deaths of children, and we do that through health education and information online and offline through our community medical outreaches to indigent communities where they have very limited access to pediatricians and to health professionals. So thank you so much for being part of this. And so Ask the Pediatrician Hour is one of our programs that we do where we talk about important issues that affect the health of our children. We want to empower you with the right information to make sure you know how to keep our children safe and healthy, especially for those of us living in sub-Saharan Africa, where more than 90% of under 5 deaths still occur. So thank you so much for joining us today. We're so glad to have you. And if you have any question based on this topic or any issues whatsoever that has to do with the health of your children, you can always go to Ask the Pediatrician Facebook group. We're there 24 hours, Mondays to Saturdays, to answer any questions that you may have. We have doctors, pediatricians, professionals, supported by our moderators, non-medical administrators, to ensure you get evidence-based answers to your children health-related questions. Of course, we also have ATP Family Facebook group for your adult health issues as well. So feel free to make use of all our platforms. You can also read about important topics about health of children on our website, www.askthepediatricians.com. So thank you so much, everyone. And just to remind you that you can watch all the past episodes on our YouTube channel, on our Facebook page, you can also listen to them on Ask Dr. Gbemi ATP podcast. So you have not missed anything. I want to encourage you to share all the links from any of this platform with your family and friends so that they can also learn, and together we can fight the battle and win against unnecessary and preventable deaths of our children. So thank you so much for joining me today. Okay, so back to our topic for today. We're talking about malaria. Why is it so important to talk about malaria? Do you know that in 2021, half of the world's entire population was at risk of malaria? So you can imagine that a disease that is not just present in Nigeria, in Africa, but half of the world's population was at risk. That is a disease that is so important. And in fact, that year alone, there were 247 million cases of malaria in the world. 247 million cases. That is quite a lot. And about 619,000 deaths. That is 619,000 deaths from malaria alone in 2021. Of course, we all know that it's an African region that carries the high burden of malaria. When we talk about malaria global burden, we're talking about Africa. And in 2021, 95% of all those malaria cases, all those 447 million cases, 95% of them occur in Africa. And of course, 96% of those 619,000 deaths occur also in Africa. So we talk malaria, we talk Africa. So, and of course, which is very important, which you will understand why when I'm sharing our update, 80% of those malaria deaths, 80% of them occur in children under the age of 5. 80% of deaths related to malaria happen in children below the age of 5 years. So that is why it's so important to me as a pediatrician, and that's why it's so important to also ask the Paediatricians Foundation to talk and to educate about malaria. And when we talk about malaria vaccine, because a lot of you were asking me questions on malaria vaccine on Monday when we did our Q&A session as part of the World Malaria Day celebration. Many of you were asking me, oh, why is it children that are getting the vaccine? You now know why. 80% of those who die from malaria, they are not adults. 80% of them are children, not just children. They are children below the age of 5. So that is the most vulnerable population, and that is a population that we earnestly have to protect against malaria. So, and that is what I was talking about, the fact that we need to make sure we need to know about malaria, and we need to see how we can ensure that our children do not die from malaria. All right, so that is just introduction, and that is just to let us know why malaria is so important, and so that is why we're going to be discussing more about malaria today. Okay, so malaria is a life-threatening disease caused by mosquitoes. I mean, it's those tiny mosquitoes, and yet they can transfer this disease to us. Interestingly, malaria is preventable. Malaria is curable. That is one of the things that bothers people like us on Ask the Paediatricians Foundation. Why should our children be dying from a disease that we can prevent and from a disease that we can treat? And we are hopefully looking forward to getting rid of it eventually. So that is why it's so important. Malaria can be mild. Majority of you have had malaria. Maybe if you're listening to me in Nigeria or Africa, most of you have malaria. You have malaria and you go to work. You are taking your malaria treatments and you are doing everything else. So most of you have what we call mild malaria. But malaria can also be what we call life-threatening. So we have two types of malaria. We have what we call the simple everyday kind of malaria, which is what most people have, and they are still going to work. I just have malaria. Many of them don't go to hospitals. They just go and treat yourself. But we also have malaria that can make a child to be unconscious and not to talk. A child, or that can cause almost all the organs in the body to shut down, and that can lead to death. And that is what we call severe malaria. And when we're talking severe malaria, we're talking of children below the age of 5. They are the ones that are most vulnerable, and that is why 80% of deaths related to malaria are due to those severe malaria cases, and those severe malaria cases happen in our children below the age of 5 years. So what are the symptoms of malaria? You all know a fever. Fever is so common symptom in malaria that some people always think fever actually means malaria. I see a lot of mothers, people posting our groups, especially using it interchangeably. So people will say, I have fever, but what they actually means is that I have malaria. So they use it interchangeably. And I spend a whole lot of time trying to correct that impression. Every fever is not malaria. Fever just means your body is hot. So, but people always think fever, malaria, fever. Sometimes we even call it together that way. However, fever just is not a disease. Fever is just a symptom or a sign, depending on who is picking it up. That means body is hot. So when we use a thermometer, the temperature is high, and that just means fever. But fever can be due to several things. Of course, in Nigeria, in Africa, malaria is number one. Okay, so but please bear in mind that malaria is not synonymous with fever, and fever does not automatically mean that your child has malaria. So it's very, very important for us to get that. So fever is one of the most common symptoms of malaria. People can also have chills, that feeling cold inside. Sometimes children are not able to tell us that. Sometimes they have headaches. So those are just, common symptoms. People say my mouth is bitter. I don't have appetite. They have what we call general malaise. You are just not yourself. You are feeling tired, weak, just sick. So those are the symptoms of the mild or simple malaria. But severe malaria, they can become confused, they can be unconscious, they can have convulsions, they can have difficulty with breathing. Malaria can affect virtually all the organ systems. It can affect the brain, it can affect the kidneys, it can affect any organ in the body, the liver. And when people have those organs being affected, then we're talking about severe malaria. So the people that are at risk of severe malaria, which is where the problem is, which is why we're talking about it, are the children. Children below the age of 5, infant, children less than 1, children below the age of 5, pregnant women, okay? Pregnant women, then travelers, those who are coming from areas where they don't have malaria, like our Caucasians, friends, and people from outside malaria endemic area, people who are coming from malaria-free zones, coming to malaria endemic area, or people who already have HIV/AIDS. Those are the people that are at risk of severe malaria. So those are the people that we really need. We're concerned about people that are likely going to have severe malaria, and they're the one likely to die from malaria. So that is that. Like I said, malaria is preventable, because malaria is caused by mosquito bites. But let me just quickly say it's not every mosquito bites that will cause malaria. Because a lot of mothers will tell me, oh, Dr. Gbemi, I see mosquito bites on my children. Should I go and just treat her for malaria? And I always say no. Okay? You can have mosquito bites and not have malaria. Okay, let me just quickly use this opportunity to explain how malaria happens. So there's actually what we call the malaria parasites. The malaria parasite is called Plasmodium. There are different, about 4 types of them, but the one that tends to cause serious, severe malaria is what we call Plasmodium falciparum. That is a big medical jargon for it, Plasmodium falciparum. So Plasmodium is actually what causes the malaria. Okay, and that Plasmodium has to enter into the blood for it to cause malaria. So what happens is that the mosquitoes, not even every mosquito carries malaria. There are different kind of mosquitoes, but we have what we call the Anopheles mosquitoes. I'm sure some of you will remember it from your science class. So we have the Anopheles mosquitoes, and not only just the Anopheles mosquito, it's actually the female Anopheles mosquito. So the female Anopheles mosquito has to bite somebody who already has malaria parasite or who already has malaria. So when they bite that person and suck the blood, because that is what mosquito does. So when they land on you and biting you, they're actually sucking your blood. And it is the female one. So when the female Anopheles mosquitoes bites someone who has malaria, parasite already in their blood, and takes that part of that malaria parasite into their own body, then that mosquito will now go and bite another person who does not have malaria, and then they will introduce the malaria parasite into the blood of this second person, and that malaria parasite will go into the red blood cells, and then that person is now, after what we call the period of incubation, which can be between 9 to 14 days. So that is why you don't have malaria immediately you get the mosquito bites. It takes a few days for it to attack your red blood cells, multiply inside the red blood cells, and begin to break down the red blood cells. Because it is when the parasites enter into the red blood cells, multiply into inside the red blood cells, and then break the red blood cells and release what we call some toxins and stuff. It is those things that cause you to have all the fever and the chills, and then you now start having that symptom of malaria. So it is not every mosquito bite that will lead to malaria. You can have a mosquito bite. If the mosquito biting you does not have malaria parasite inside the mosquito, you're not going to have malaria. And again, it's going to happen after like 9 to 14 days for Plasmodium falciparum. And then it is the multiplication and the breakdown of the red blood cells that will now lead to the symptom of malaria that the person will have. So this is how malaria happens. So which means malaria is completely preventable. If you don't have mosquito bites, you will not have malaria, because you need to be bitten by a mosquito that has already sucked the blood from somebody who has malaria parasite for you to have malaria. So if we can protect you from having the mosquito bites, then you are not going to have malaria parasite introduced into the blood, and then you're not going to have malaria. So that is one way by which malaria can be prevented. So but that is a major way. But of course, if blood that is contaminated with malaria parasites is given to you for any reasons, then you can also be transfused with malaria. So people that are transfused with blood, sometimes they can get malaria from the blood transfusion and all that. But because it's so common, because many people, malaria is what we call endemic, like it is something we have with us all year round in Africa. So the chances of the mosquito biting somebody who has malaria or has malaria parasites in them is so high. So that is why it's so easy for the malaria to spread so easily. So again, after the mosquito has bitten you, the symptoms will start within 10 to 15 days. So treating somebody who just gotten bitten, whether you don't even know whether they have malaria parasite introduced into them or not, and you don't know whether they are going to develop malaria or not, is futile. So you have to wait until they have symptoms, which can take up to 10 to 15 days. And like I said, it can just be mild fever and all that. But for the children or pregnant women, for those who are going to have severe malaria, they are the ones that have the very serious symptoms of very extreme tiredness. They are what we call prostrate, like they can't get up, they are very tired, very fatigued. They sometimes become confused, they're drowsy, and the children, they can become unconscious. Sometimes the children have convulsions. You can have convulsions with fever, and then they become unconscious, what we call cerebral malaria. They can have difficulty with breathing, so they can have yellow eyes, and they can have passing bloody urine. The kidney can shut down, and they can have what we call renal failure. They can be bleeding. So malaria can cause so many symptoms in children, in especially when it is severe. So luckily, malaria is treatable. It's one of the most is easily treatable condition that we have. So we have drugs. The most important thing is to make the correct diagnosis of malaria, because malaria is so common in Nigeria, in sub-Saharan Africa. Many people, once they have fever, they just go and buy anti-malaria treatment, and sometimes it is not malaria. So, which is a major challenge we had over years, and people will develop. We now have what we call development of malaria resistance drugs. So initially, when I was growing up, it was chloroquine that we used to treat malaria, but nobody used chloroquine these days. So I still see people telling me they're using chloroquine. The reason why we don't use chloroquine anymore is because it's not working again. It's the malaria parasite. They have developed their own resistance to those drugs, which is our major challenge. So as we are developing drugs against the malaria parasite are also becoming wiser and developing their own strategy, what we call resistance, on how to ensure that those drugs do not work on them. So that is the main challenge. But currently, we are now using what we call combination therapy for treating malaria. In other words, instead of just using one malaria drug, we use two malaria drugs at the same time to deal with the malaria parasite. And we have what we call artemisinin based combination therapy. That is, out of those two drugs, one of them must be from the artemisinin based family. And these drugs are available. Malaria, because malaria is so common in Africa, in Nigeria, we make malaria drugs like over the counter. In other words, you don't need a doctor's prescription, and we even made it in a way that it's already packaged according to your age. So for the children, for example, for maybe this age to this age, or this weight to this weight, your pack is already complete there. This is the tablet you're going to take. Usually it's one tablet every 12 hours for 3 days, and that's it. So it's already pre-packaged to make sure that everybody knows what to do. So it can be artemeter with like something like Coatem, and it has its own combination, or it could be those ones already mixed together. It comes as just one tablet, or it could be something like artesunate and camoquine, which will be two different tablets, but they will be packed together, and you know they will tell you this is what you take day one, this is what you take day two, this is what you take day three. We have different combination. We have the alaxin, piperazine, and all the p-alaxin combined together. There are so many kind of drugs that we use, in treating malaria, which anyone can buy. But what we recommend is that don't just treat every fever as malaria. Actually, for the children, I mean, as a pediatrician now, if your child has fever, don't assume malaria, okay? And there's also a practice. When I was growing up, so I remember my parents would always give us Sunday medicine, okay? It's part of prevention against malaria. So every Sunday we take Sunday medicine is to kind of protect us against having malaria, but we don't do that anymore. I will talk about prevention of malaria later, but let me just stick to the treatment. So if your child does not have malaria, please do not treat them for malaria. It is so important, because one of the things we are also trying to do is that most of us that are adults, we tend to have simple malaria because we've had so much malaria, we have developed some partial immunity against malaria. So even though you have malaria, it will be mild. So you have your malaria, you are still going to work, you are still doing everything. So you have partial immunity against malaria because you've been exposed to malaria over years. All right. So if you treat your children all the time for malaria, even when you don't have malaria, you will not allow them that opportunity to develop that partial immunity against malaria. So they will be behaving like somebody who comes from malaria-free area, which means that they will be prone to having severe malaria. So do not treat children unnecessary. I see a lot of mothers giving their children malaria drugs every 3 months. I get that question every time, almost every week. Like, how should my child is fine? No, it doesn't have any symptoms. Should I go and treat her for malaria? Or how often should I be treating my children malaria? How often should I be giving my children anti-malaria drugs? And I always like to say, please do not give children anti-malaria drugs if they do not have malaria. That is number one. Don't treat if they don't have malaria. Mosquito bite is not malaria. Like I said earlier, if you can have mosquito bites and not have malaria, because it is not every mosquito bite that introduce malaria parasite into the blood. So if the mosquito bite did not introduce malaria parasite, the child may have mosquito bite and not have malaria 2 weeks down the line. So there's really no need to treat the child. And then if the child has fever, there are many causes of fever in children. Okay, there are many causes. So any system or organ or tissue in the body can cause fever. So a child is having respiratory tract infection, they are going to have fever. A child has ear infection, they are going to have fever. A child is having even boils or skin infection, they are going to have fever. A child is having pharyngitis, sore throats, they can have fever. So a child is having urinary tract infection, they can have fever. So let's not always assume every fever is malaria. It is not. Okay. And for us as pediatricians, we always like to know what is the cause of the fever. So when you come to us, we will ask questions. So we ask you, the child has fever, what are the other symptoms? If the child has fever and is coughing and, sneezing and having catarrh, it is very unlikely to be malaria. It's most likely a respiratory tract infection. That is how we work. If a child has fever and is having ear discharge, pus is coming from the ears, it is more likely to be ear infection rather than malaria, okay? If a child has fever and is complaining of pain when passing urine, or they are going to pass urine every few minutes, it's most likely a urinary tract infection and not malaria. So that is how doctors work. And sometimes we are not sure, because maybe it's only the fever and the vomiting and the poor appetite. So we're not sure, is it malaria, is it infection, is it something else? So we sometimes take blood. So we take blood from the baby or the child and send it to the lab, and we can easily confirm malaria by what we call malaria parasite test. So there are two tests we do. Most private hospitals can do what we call a rapid test. You don't need to be a lab scientist to do those kind of tests. It's a test you just do and you get your answer immediately, but it can also give false positive. So that's why sometimes some people say every time I do malaria test, my child is always having at least 1+. Sometimes it is just false. But if it is like 2-3 pluses, then yeah, that looks significant. But there is a more standard test, what we call the thick and thin film, uh, looking for malaria parasite. Usually that require a microscope, that require a scientist, a laboratory scientist who can look into the microscope and see the malaria parasite and count how many of them they can see. That is the gold standard test. So sometimes we really need to do that, but most, that takes time. It requires somebody who is a trained person and all that, of course, so it's more expensive. So most people don't wait for that. So we do the rapid test, rapid antigen test. Malaria parasites, is malaria parasite there, it's there, but sometimes we may have to go and do the proper thick and thin film smear looking for the malaria parasite, which is a gold standard for diagnosing malaria. So we need to see malaria parasites in the blood, either by the rapid test or by the film, malaria film, the blood film to look for malaria parasite for us to confirm that the child has malaria. So I noticed that some, well, I'm not sure, but I noticed that some hospitals or some labs, everybody is always getting 1+ malaria. I have a feeling that some of them are not doing the test right. And so that's why some mothers will tell me every time your child has fever, every week or every month, and every time it is malaria parasite, you may want to go to another lab, another hospital, be sure that they actually, because it's very unlikely, because malaria parasite has a cycle. In other words, your child has to be bitten by malaria, a mosquito carrying malaria parasite. It will take 2 weeks after that for your child to develop malaria. Okay, so if it takes 2 weeks for your child to develop malaria, and let's say we just diagnose malaria, so it's very unlikely, and we're treating the child, it will take another 2 weeks again before your child will, even let's say by the day we finish the treatment, the child was bitten again by a mosquito that has malaria parasite. It take another 2 weeks. So for those of you that your child is always having fever every day, every month, every week, and every time it's always malaria, it is very unlikely. So we need to be sure that the lab are actually doing the right thing. So that is one thing. So we need to confirm by a blood test that there are malaria parasites in the blood, and not just that there's one tiny 1+. We have to really see enough of it to know that, okay, yes, this child truly has malaria, because some of us have malaria parasite but we don't have malaria because we as we live in Africa, we live in Nigeria, so malaria is part of us almost. So but if you're having symptoms and of course we have malaria parasites in your blood, then we have confirmed that the child has malaria, and that as a point at which we treat the child. I know we doctors have confused mothers, because at the time we were trying to roll back malaria, we're trying to get rid of malaria. So we say, okay, even if your child has fever, even if you don't have symptoms, any other, if you don't have to wait for confirmation, go and treat. But now we're saying no, let's not do that anymore, because we now have a rapid test that, at least the simple test that most of the hospital can do. So they don't need to have lab scientists to do that one. So now we request that before you treat malaria, you actually do a malaria test. Even if it's just a rapid test, you must confirm that your child has malaria before we now give malaria drugs. It is so important, because if we don't confirm that this child has malaria, and sometimes this is something else, and we're treating malaria, I can give instances, even to things that happen to people that I know. And most of the time, when children have fever, everybody just assumes malaria, then they're treating malaria. I've seen a child who has meningitis and it was missed, or it was the diagnosis was picked up late. And of course, the child died because everybody was assuming malaria. This is a dangerous approach when it comes to children, which is why I always encourage mothers, if our children are sick, please don't wear the doctor's hat. I know, life is difficult, money is not always there, and mothers, I thank you, I salute you. You wear a lot of hats, and sometimes you also wear the doctor hats as well. Please, when it comes to children, I plead with you not to wear your doctor's hat a lot of the time. Please take the children to the hospital. Don't just say it's malaria, just go and buy malaria drugs. Some of you will tell me I've treated malaria, I've given antibiotics, I've given you know what to do, which is dangerous, because we can mix those very dangerous conditions that can kill the children Meningitis is one of them that we miss. And sometimes when people are talking to me, even from the first sentence, I already know that this is not malaria. This child is having this symptom, this having convulsion, child is having this. It is very unlikely to be malaria. If I thought it's going to be malaria, maybe severe malaria, which has to be treated in the hospital. So it is not every malaria that we treat at home. Simple malaria, yes, you treat at home. Severe malaria, the child has to be admitted to the hospital for proper management, because usually we treat it through giving the drugs into the vein or injection into the muscle. It has to be done in the hospital. It's not the one you're going home and coming back. That's the treatment for severe malaria has to be in the hospital. It's not just the malaria drug. We're also doing what we call supportive management for the organs that have been affected, because in severe malaria, there is involvement of at least one organ system that is compromised, that needs to be supported, in addition to giving the malaria drugs, because those are the things that can kill the children. So going back again to summarize malaria treatment, if your child must have symptoms, you must take the child to the hospital. The malaria diagnosis must be confirmed by blood test, and then the doctors will recommend the treatment. The treatment is usually we've already prepared malaria drugs, but it must be combination drugs. I still see a lot of mothers giving only camoquine, or just giving only Fancida, or just giving only artesunate. That is monotherapy, and it is not right. We don't do that anymore. I even see people still using chloroquine in this 21st century. That is not acceptable. Some of you, maybe in the villages, they just still have those chloroquine. I wonder where they get them from. It is not acceptable. So the drugs must be 2 drugs combined. So things like Coartem, things like artesunate with camoquine and all that, or P-alaxin. It must be, when you read the breakdown of the drugs inside it must be 2 drugs combined together. Some of them are already combined into one tablet. So the child just take one in the morning, one in the evening for 3 days. Or some of them, you will see that there are 2 separate tablets. Some of them are combined, that the child just needs to take one tablet, or liquid. They have already mixed them together in the liquid, and it's just once a day treatment for 3 days. Doesn't really matter. There are different ways all those drugs are combined, and different regimen in terms of twice a day, once a day. But the most important thing is that there must be 2 active drugs at once given. It must be a combination therapy. It must be artemisinin based combination therapy, and you must complete the treatment. I know sometimes you give the treatment day 1, the child is already doing well. Please, you have to complete it for the 3 days, because we are waging war against resistance. If we don't use our drugs properly, then we're not going to win the battle. But if your child has severe malaria, I've already told us the symptoms of severe malaria, that child has to be admitted to the hospital. The pediatrician have to manage that child. Usually we give injection or intravenous anti-malaria. Usually it's either artemether injection or artesunate drip. We give it, and usually we start it for the first 24 hours. Most children will begin to respond, and as they begin to respond, we can stop the injection or the drip and now change the children to, once they can eat, we change them to the tablets again for 3 days, or liquid or whatever, for 3 days to complete the malaria treatment. We also have quinine, which we reserve again for severe malaria. So that's how we treat malaria. So malaria is easily treatable, but we must not miss the diagnosis, and we must start on time, and we must ensure that if it's severe malaria, we are very, very aggressive in treating severe malaria. Now let's talk about prevention, which is where I'm going to be giving my updates. How do we prevent malaria? Malaria is actually preventable, and we're looking forward to the day where we can completely eliminate malaria. Number 1 is to, if you don't have mosquito bites, you're not going to have malaria. So we need to ensure that our children sleep under the mosquito nets. I know mothers always, there's no light, it's hot, the children are sweating. We always have excuses for all these things, but it is what it is. Remember, malaria can kill our children. 80% of deaths from severe malaria are in children. So children must sleep under mosquito-treated nets. And these mosquito nets are not just the ordinary mosquito net. They are mosquito nets that have been impregnated with chemicals, so that even when the mosquito lands on them, it will kill the mosquito. The mosquito does not need to enter the net. Number one, the mosquito cannot bite the child because the net is the holes are so small for the mosquito to go through. Two, as the mosquito is landing on that net, it is killing it. So that is one. You can also use mosquito repellent cream from children about 2-3 months old and above. They can use mosquito cream because sometimes you carry the children outside in the evening, to have family time before they sleep. So mosquito usually bite children in the evening time to the early hours of the morning. So that is the time. So when you're putting the children outside, I always say please wear them long sleeves. If it's hot, you don't want to wear them long sleeves, you may want to rub mosquito repellent cream on them. Also, even your environment, you want to get rid of mosquito. Mosquito thrive in all these bushes and where you have water, stagnant water, and all that. So you want to get rid of bushes, you want to get rid of stagnant water, you want to keep your environment free from all that. We can fumigate our house, we can use mosquitoes sprays, insecticide sprays, and whatever you want to do. Well, because those things are very irritant to children. If you spray, you have to make sure the house is free from all the odors before you bring the children back in. Those are all the things we can do to first of all make sure that at least the mosquito does not even come near the children, because no mosquito bites, no malaria. So that is number one thing that we can do. The second way by which we can prevent malaria is through drugs. It's really for people that are at severe, that are risk of severe malaria. Pregnant women, for example, they treat you for malaria during pregnancy. You don't have malaria, but they treat you with Fancida twice. So that is part of prevention. Children with sickle cell anemia, we give them paludrin. They take it every day, and it's for life. So they have to take paludrin daily for life. And that is how we prevent malaria in them, because malaria in them can be a death sentence for them. Also, people that are not living malaria endemic area, including those of you who are Nigerians or Africans who have lived abroad for years. You live in US, in UK, outside the country for several years. You are, as far as malaria is concerned, you are more or less a Caucasian now. So when you're coming back to Nigeria to visit family, you're coming back to Africa, please, you have to take drugs to prevent malaria, because you will behave like somebody who is coming from a malaria free area. So your immunity has waned, and so you are at risk of having severe malaria. So we recommend you use your malaria chemo prophylaxis depending on what is recommended where you live. You start using them 2 to 3 weeks even before you come, and you use it throughout, and for 1 week, even at least some even say 4 weeks after you've left, you must keep on taking your malaria drugs. So these are ways by which we can prevent malaria. And finally, the major updates, drum roll, we now have malaria vaccine. Yes, we have malaria vaccine. In 2021, the first malaria vaccine, RTSX, was released. And it was ongoing, and well, it's not yet where we want it to be, but currently now another malaria vaccine was just recently launched by Oxford University, and the Nigerian government has already approved that malaria vaccine for our children. So anytime that malaria vaccine is going to be available for children between the ages of 3 months and to 5 years. So it is not for everybody yet. Okay, but like I was telling mothers that were asking me questions on ATP, this vaccine, because the children below the age of 5, they are they are the ones that are more likely to die from malaria. So we are focusing on them first. I know many of you want to also um you want to also uh, take the vaccine. But like I said, you are likely not going to die from malaria if you have malaria, because you're going to have the simple malaria. So um, that is not likely going to kill you. But children below the age of 5, they are the one that are likely going to have the severe malaria. They're the one likely going to die from malaria. So they are the one that we need to protect first. Okay, maybe later it will get to the rest of us, but we have to protect the children first. So Ghana and Nigeria have approved the Oxford vaccine for malaria, and it's going to be available very soon. And we're going to be giving it to children from the age of 5 months to 36 months. It's going to be 5 months to 36 months. They are still working, they are still doing, when clinical trials ongoing, we need to check that it's working. They've tried it, so there's still a lot of work. So it's still a work in progress, but it's going to be available very, very soon. We believe the efficacy is about 77%. And so there's still a lot of trial going on. It's about what we call phase 4 trial. So a lot of children have been tried already in other African countries like Burkina Faso, Kenya, Mali, and they find it very effective. So we are also going to join very soon. So mothers, be on the lookout for the malaria vaccine. Be on the lookout. Immediately you hear PAM malaria vaccine is available, please take your children and go and get the vaccine. Of course, it's going to be free and it's going to be available through our health centers, but the primary focus are going to be children between the age of 5 months to 36 months in the initial phase. Okay, we may, they will let us know later. The National PAC agency and the NAFDAC and all that, they will let us know later on whether we're going to extend it to the older children and whether adults are even going to take it. But for now, it's going to be available only for children between the age of 5 to 36 months. So that's the good news that we brought to you today about malaria. We seem to be winning in the battle against malaria, actually for our under 5 children, who are the ones that are most likely to die. We also, in some parts of Nigeria, we also want to do seasonal chemoprophylaxis. In other words, once we get to the season when malaria is very common, we just treat the children for malaria regularly. So some of you that live in the northern part of the country, you are aware of that. That also seems to help. But I don't know now that we're going to be having the vaccine, whether that's going to be scrapped or something. But for now, if you are living in the areas, including in the northern part of the country, where we do seasonal chemoprophylaxis, where we just treat the children for malaria, maybe consecutively every month or so, then you should just keep taking the medication. No need to worry. But the most important thing is that we don't want our children to have severe malaria because we don't want them to die from malaria. So malaria is a disease that is there. We have a lot of hope. Okay, we have a lot of hope. Unfortunately, the mosquito and the malaria parasite, they've been so difficult to deal with, but I think we are getting towards the end of it. We're getting towards the end of where we're going to have what we call zero malaria. We're working towards what we call elimination. And the reason why we have hope is that there are countries that used to have malaria too, like us, and they've been able to eliminate malaria completely in their countries. So in 2021, Even there are about 35 countries have reported fewer than 1,000 cases of malaria. So that means, a lot more countries are becoming malaria free, and WHO is now certifying some countries malaria free. In 2015, 9 countries have been certified malaria free, like the Maldives, Sri Lanka, Paraguay, Uzbekistan, Argentina, Algeria, China. So all these countries have just been certified malaria free. And so we are looking forward to the day where we will also become, those of us in Nigeria, in Sub-Saharan Africa, will also become malaria free. So that is the goal to get uh, the entire world to be completely free from malaria. So we're looking forward to that. But currently, the World Health Organization is looking forward to reducing the cases by at least 90% by the year 2030. So we are already in 2023. So we have 7 years towards that goal, and I'm not sure whether we're close. We're supposed to reduce the deaths by 90% also by 2030. We want to eliminate malaria again in another 35 countries by the year 2030. When we set these goals, they look so far away. But now I'm looking at it like this is 2023. We have 7 years. How close are we towards getting close to these goals? But I think now that we're having malaria vaccine, we're having 2 of them now, maybe we're getting closer and closer. At least if we can just eliminate the deaths of malaria, especially in our under 5, then we can always deal with the rest of the malaria elimination itself over time. So thank you so much for listening. For those of you who are just joining, thank you. You've been talking about malaria, and we all know what malaria is. So I've just kind of reminded us that this malaria is a condition. It can be life-threatening, can be simple, and it is caused by what we call Plasmodium species, actually the Plasmodium falciparum, which is the malaria parasite spread through mosquito bites. Malaria can be simple, in which case you have just mild symptoms and you'll be fine. But it can also be life-threatening if it is severe malaria, especially in very vulnerable population like the children under the age of 5, the pregnant women, travelers from malaria-free areas, and children with sickle cell anemia. And those are the population at risk of severe malaria. We talk about the symptoms of malaria. We've talked about how to diagnose malaria. It is very easy to diagnose malaria. There are blood tests, rapid tests, and also the blood film test. And malaria is treatable. We have drugs that are even over-the-counter drugs, but please use combination drugs. Avoid using all those drugs that have now been condemned because the resistance against them is so high, like chloroquine. And of course, malaria, if it is severe malaria, has to be managed in the hospital. The child has to be admitted and monitored. And once the child is getting better, we convert them to oral medication. Malaria is preventable. Avoid the mosquito bites at all costs. Avoid mosquito bites, okay? And of course, for our children below the age of 36 months, in Nigeria, the good news is that we are going to have malaria vaccine soon. So please ensure that immediately you hear that the vaccine is available. We don't have a date yet, but trust, you can trust me to keep you updated and to announce it over the house stop everywhere. Once the malaria vaccine is available, which we believe will be available in a couple of months, please take your children. When we start new vaccine, we usually do it as a phase. We roll it out gradually. We don't just give everybody at once, so they roll it out. So we're rolling out and starting first with children between 5 months and 36 months. Don't be jealous. We have to protect these children because they are the ones that are likely going to die from malaria. 80% of malaria deaths occur in children below the age of 5. So that is why they are the ones that have to be protected at all costs. So that is what we're looking forward to. And hopefully we look forward to the day where many countries are becoming free from malaria. And I look forward to the day where Africa, most of Africa and Nigeria especially, will be declared malaria-free area. And I know that we seem that goal is getting closer day by day. So thank you so much for watching. If you have any questions, feel free to post your question on Ask the Pediatricians Facebook group. I will answer them. We already had a question and answer session on our Facebook group on Monday. Is it Monday? Yeah, Monday. No, Tuesday, sorry, and that was the World Malaria Day proper on the 25th. And so I believe some of you have asked your questions. The question that seems to be coming out is the malaria vaccine, when is it coming? Why is it so many children? And I believe I've just answered them. So the malaria vaccine is coming. We don't have a date yet, but we'll let you know. It's going to be for children 5 to 36 months. Later, we'll let you know whether it's going to spread to other people, and we believe it's going to help us reduce the cases and deaths of our children from malaria. Thank you so much, and I look forward to seeing you same time next week when we will be talking about another important issue that has to do with the health of our children. Just also remind you that this week is actually what we call the World Immunization Week. I didn't really talk about it, but then we've been creating awareness about it. So the theme for this week is the big catch up. So just another announcement to say that if your child has not taken any of those other vaccines that are already available, please, you can still go and catch up. Go and catch up now. So don't say, oh, malaria vaccine, the one that you already have, the BCG, the Rota, the hepatitis B, the Penta, the pneumococcal vaccine. Please go and take those ones. If you have mixed them, you can still take them. Apart from Rota, most of the other vaccines we can always give the children, at least even as long as they're still below 5, we can give them most of those vaccines. And some of them we can give them for as long as they have not taken like BCG. We can even give adults. So please, this is a World Immunization Week, and if there's any message I have for you, is for you to go and catch up on all the ones you've mixed already, and watch out for the malaria vaccine that is joining the league of all the vaccines that we're going to have now, and make sure that your children have fully immunized, because immunization is one of the most cost-effective public health intervention. The children do not have to have the disease when they can get immunization and be protected from having it. So the government has spent so much money to make these vaccines available. All that we need to do as parents is to just take our children there and get it. So we have no excuse. So we have to make sure that we get all our children fully immunized. Thank you so much for watching. Have a wonderful day, and let's keep working and supporting and innovating and implementing all these strategies until our country and the entire sub-Saharan African region become malaria free. Bye.
Are you a mother, father, or you are involved in caring for children? If yes, then listen to Ask the Pediatricians every Thursday by 10 a.m. for insightful discussion on popular child health topics such as dangerous child health practices, immunization, infant feeding, developmental milestones, and so much more. You also get to ask questions on these topics and listen to answers to real-life child health issues by a pediatrician. Ask the Paediatricians Foundation is devoted to health education and information of parents and caregivers of children in the community to support you in raising healthy children. Don't miss Ask the Paediatricians with Dr. Gbemi, because it's informative, educative, and interactive. Ask the Paediatricians Hour, the program for caring parents.